Welcome to our webinar, Los Angeles Fires and Public Health, Where We Go From Here. I'm Ron Brookmeyer, Dean of the UCLA Fielding School of Public Health. The devastation from the fires here in LA is heartbreaking. At least 29 people have died. Many people here in our UCLA community and beyond have lost their homes, businesses, and neighborhoods. More than 16,000 structures have been reported destroyed. More than 47,000 acres of land burned, roughly the size of Washington, D.C. We are only beginning to understand the magnitude of loss and its public health impact. There are so many questions that need to be answered. Is the air safe? The water? Can those who evacuated return safely to their homes? Will there be exposure to harmful toxins as cleanup gets underway? What are the short and long-term health effects of the fires? And not just the physical health effects, but mental health too. What will be the impact on children uprooted from their homes and neighborhoods? And going forward, what can we do to prevent or at least mitigate the devastation of future fires? Today, we hope to begin to address some of these questions. You will hear from UCLA Fielding School of Public Health experts, each of whom will speak briefly about the fires from the perspective of their expertise. Following the presentations, we will have a question and answer session led by UCLA Fielding Professor, Dr. Rachael Jones. You can submit questions by clicking on the Q&A button near the bottom of your screen. Our first expert today, Dr. David Eisenman, is a professor in the UCLA Fielding School of Public Health, Department of Community Health Sciences, director of our school's Center for Public Health and Disasters, and a professor at the David Geffen School of Medicine at UCLA. David, thank you very much for joining us.
Thank you, Ron. It's a pleasure to be here. So in the aftermath of our devastating fire, returning to our burned neighborhoods and mountains, we are seeking guidance and to rebuild better. The fire transformed everything: our air, soil, landscapes, and institutions. And at the risk of mixing my disaster metaphors, this is our Hurricane Katrina, an epical disaster that is changing Los Angeles, and I want to offer some ideas for moving forward. Unfortunately, LA's risk communications fell short during the fire. First, there were the daily fire updates with each agency saying thank you to each other in the room. Then there were vague health recommendations and few that seemed timely and actionable. Town halls from local public radio and from UCLA and University of California partners are filling this gap. Now there is an alphabet soup of state agencies who are monitoring air, water, and soil and sharing their results on their separate websites. Still, no one is giving daily coordinated communications. The timeline for this is moving past us as people are moving back. Moving forward, we need a single authoritative source to communicate in the future. We need to distill and preserve the great practical advice coming from these town halls and websites and pre-package them into easily distributed explainers giving step-by-step instructions. Evacuation planning was also inadequate, with devastating consequences. Disabled individuals who were unable to evacuate lost their lives. We need to improve our systems for identifying and helping those who require assistance during emergencies. We learn time and again that neighbors helping neighbors create resilient communities. Let's reinvigorate LA's community resilience programs, which disappeared during the pandemic when we were unable to meet and plan together. And let's do this for the disasters our particular neighborhoods now face. This disaster also demands that our communities change our approach to disaster preparedness. Preparedness for fires must become higher priorities. It's not just preparing for earthquakes. Preparing now includes learning how to quickly pack a go bag even if you live in the flats. We are also mourning the destruction of mountains and cherished parks and trails. We are grieving for the loss of the landscape. I teared up watching the fire ravage Will Rogers State Historic Park. Please spare the footbridge connecting to the Backbone Trail, I thought. This landscape, where I hiked weekly to regain psychological, emotional, and spiritual solace, was one of LA's great resources. Residents are returning to landscapes that have been changed vividly from those where they previously recreated and sought solace. There is a word for this, solastalgia, meaning the loss of solace and distress caused by environmental damage. Though the landscapes will regenerate, until then, their loss compounds our grief, and I bet it takes years before the chasm-spanning footbridge is rebuilt. Recognizing our solastalgia-related distress may be useful in developing community recovery programs. That the physical changes seen in our post-wildfire community may contribute to psychological distress, even for those who did not experience other direct traumas of the fire, hints at community recovery programs that wed psychology and forest management. Land managers, community psychologists, and local volunteers might promote community psychological recovery by helping individuals regain their connection to the land. Finally, an inadequately understood trend is the growing number of residents who choose to stay behind to fight fires themselves. For over a decade, I've observed this rise, yet we still lack critical knowledge about their immediate and long-term health risks they face. We know that some people died with, quote, water hoses in their hands, according to the LA Times, fighting to save their home. But how many will suffer from lung damage or post-traumatic stress in the years to come? We need to better understand these risks so we can develop programs to protect these individuals who are stepping in where systems are overstretched. And we need to stand up programs that formally recognize, train, equip, and support community members who are going to stay and defend homes. Thank you.
Thank you so much, David. Our next presenter, Dr. Yifang Zhu, is a professor in the UCLA Fielding School of Public Health, Department of Environmental Health Sciences, and an expert on air quality. Thank you so much for joining us, Yifang.
Thank you, Ron, for the introduction. I know air quality is in people's mind, and there can be some confusion about what the air quality index measures. I'm happy to share some insights and introduce practical measures that we can take to protect ourselves. So let's start from the air quality index, or AQI. So these two measures 5 major air pollutants that include ozone, particulate matter, carbon monoxide, sulfur dioxide, and nitrogen dioxide. In Los Angeles, the most concerning pollutants are PM2.5, or fine particles, year-round, and ozone, especially during summertime. During wildfires, PM2.5 is the main driver that determines the AQI. Those small particles can be inhaled into the deep lungs and cause a very wide range of adverse health effects. You can track AQIs through those reliable sources listed on this slide, including EPA's AirNow website, the Fire and Smoke Map, and South Coast Air Quality Management District's website. For rapid changing conditions, during the fire, when wind is changing and the fire emissions are also dynamic, I found the local sensor networks, such as the Purple Air listed here, particularly useful for tracking real-time data. While individual air sensors, their readings may not always be accurate, but when you see a cluster of sensors turning red, it's a clear indicator that the air quality is bad. I also found the Watch Duty app very helpful during the fires. It provides information almost in real time for fires, evacuation zone, AQI, and wind pattern, and among others, all on one map, which gives me a very comprehensive view of the situation that we're facing. For example, if you see on this slide, during the Hughes fire, when the Hughes fire started, the AQI measured by those downwind sensors along the wind trajectory turn red, while other sensors still remain green. So we know the AQI reflects the level of PM 2.5 in the air, but the smoky smell comes from gas-phase pollutants, volatile organic compounds, or VOCs. This explains why during fire sometimes the AQI might look good, but you can still smell smoke. This often leads to confusion and raises questions about the accuracy of AQI. So how does this happen? Because VOCs are gaseous molecules, they diffuse much faster than fine particles. On windy days, both PM 2.5 and the VOCs are transported and diluted by the wind. So if AQI is good, VOC levels are likely to be low as well. But when the wind is weak, VOCs can diffuse quickly, while particles tend to settle and deposit onto different surfaces. So as a result, VOCs from fire smoke can reach you even when the particle concentrations are low. So if you can smell smoke, it means you are being exposed and should take precautions. So how can you decide if the air is safe to be outside? Well, you can check the AQI, make sure you don't smell smoke or downwind of any major active fires. And if you're especially sensitive with asthma, COPDs, children, elderly, pregnant women, or just not quite sure what's going on, it's always a good idea to limit outdoor activities during fires. So to protect yourself from smoke or just outdoor air pollution in general, here are some simple measures you can take. Stay indoors with windows and doors closed. This will reduce the infiltration of outdoor pollutants going into indoor environments. Stay indoors can also limit your physical activities so that reduce the amount of air pollutant you inhale into your lungs. Filter your indoor air by using your HVAC system if you have one with a MERV 13 or higher filters. Or you can use a certified HEPA potable air cleaners that is recommended by California Air Resource Board as listed here. And also avoid generating indoor pollutants. Activities like smoking, burning candles, or frying food without proper ventilation can also increase your exposure to PM 2.5 and VOCs. If you must go outside, wear a proper fitted N95 or KN95 mask to filter out those fine particles. But keep in mind, those masks do not protect you from VOCs. So those steps are simple yet effective for reducing your exposure to air pollutants, especially during wildfire events. I hope this information helps you to gain a better understanding of air quality and inspires you to take proactive measures to protect your health. Thank you.
Thank you so much, Yifang. Our next presenter, Dr. Michael Jerrett, is a professor in the UCLA Fielding School of Public Health, Department of Environmental Health Sciences, the Jonathan Fielding Chair in Climate Change and Public Health, and co-director of the UCLA Center for Healthy Climate Solutions here at the Fielding School of Public Health. Thank you so much for joining us, Mike.
Thank you, Ron. And I want to thank you and Carla Danley and all of your staff for organizing this timely event. I want to give people a very high-level overview of some of the health effects that you can experience from wildfire smoke. As Yifang pointed out, it's a very complex mixture. We have many different so-called primary plumes that are directly released. So from the smoke plumes, and that can include some that are highly toxic, like polycyclic aromatic hydrocarbons. And then some of them form as a result of secondary reactions in the atmosphere. And those VOCs that Yifang pointed out are one example of that. And some of them are very health active, including formaldehyde, which is a group 1 carcinogen and a powerful respiratory irritant. Most of the health effects studies we have focused on PM 2.5. These are small particles that can penetrate deeply into the lung. And when we look at typical urban PM, you can see the PM 2.5 in relation to human hair or grain of sand is very small. PM 10 is also used because it characterizes dust. But what we see from wildfire PM is that it's sometimes smaller in size than urban PM, and it can contain oxidative and pro-inflammatory components that might make it more toxic. The jury is still out on that, and there really hasn't been enough research. But suffice to say, there is definitely quantitative and qualitative difference. So how does air pollution from fires affect your health? There are about 3 major pathways. One is through dysregulating the autonomic tone. So these are the signals that get sent to our cardiovascular system from our autonomic system to control heart rate and rhythm. So if this is disrupted, it can lead to a greater risk of atrial fibrillations and heart attacks. We can also have spillover. So there can be signaling that goes on inside the lung that causes systemic inflammation that then spills over into other organ systems, including the heart and the brain. And then we can also have respiratory translocation. So when the particles are very small, they can go right through our natural defenses and go directly into our circulation. And from there, they can threaten every major organ system in the body. If we look at the early part of the life course, this is an earlier study that was done by Geffen and colleagues at Stanford University. It just shows some of the complexities of trying to pull out where the smoke plume is, trying to characterize those smoke days, and then rely on limited monitors to cross-validate those estimates. What they found is that women who were experiencing more smoke days and higher intensity were more likely to have adverse preterm birth outcomes than those in lower smoke intensity. And you can see there's some variability by trimester of exposure, but this is something that is a concern with these fires we've just experienced, that we could begin to see more adverse birth outcomes. And this is sort of interesting. We don't see a lot of changes in vulnerability based on their results, except in areas where they regularly experience a lot of smoke, that those response functions appears to be smaller here, meaning that people living in smoky areas might be taking evasive measures to protect their health of the kind that Yifeng talked about, because they're more accustomed to dealing with it than others. If we look at morbidity and emergency room visits, hospitalizations, we can see the strongest evidence we have is for respiratory effects. The cardiovascular effects are somewhat more muted, and they're still actively being investigated, but we don't see effects on the cardiovascular system that are as consistent and as strong as they are on the respiratory system. If we look at increases in mortality based on American studies that we summarized here, all cause and non-accidental mortality go up. You can see that the other outcomes, the evidence is either not there or it's more mixed. So we have some positive and some negative studies. How big is the problem? This is from a study that we published last year in the journal Science Advances. This just shows the excess number of deaths that occur every year. And you can see there's some variability. So for those really bad smoke years like 2018, we're getting up to about 12,000 deaths a year, depending on how we characterize the exposure. Over an 11-year period, it's more than 50,000 deaths. The monetary estimate is about $430 billion. And I think this, falls on what Dr. Eisenman was saying, that society is likely underinvesting in wildfire prevention and response, and we really need to step up now that we've seen the absolute devastation we experienced in Los Angeles. Some of the emerging evidence, there's a very high quality study based on the Kaiser Permanente electronic health records, showing about an 18% increase in incident dementia in a big sample of more than 1.1 million people. We've got additional evidence on dermatological healthcare utilization, ocular, so eye irritations. And then an interesting study that was done by Professor Colin Reed at the University of Colorado showed that people returning to smoke damaged structures reported increases in headaches and a strange taste in their mouth many months after the exposure. There are many unanswered questions here, and perhaps we can just look at these quickly, and I can deal with them during the question and answer event. And I'd like to conclude there in the interest of time. Thank you.
Thank you so much, Mike. Our next presenter, Dr. Dana Rose Garfin, is Associate Professor in the Department of Community Health Sciences at the UCLA Fielding School of Public Health and an expert on mental health effects during devastating events like the fires. Thank you so much for joining us, Dana.
Thank you. Over the past several weeks, our community has been shaken by the devastating impacts of the Southern California wildfires. Such an event is truly a collective trauma, which is defined as a large-scale event that impacts the population broadly through multiple forms of exposure. Indeed, individuals in our Southern California community have been impacted by multiple overlapping forms of trauma exposure to the wildfires. Many have been impacted by the direct physical effects of the fire. These include the physical impacts of the fire, including smoke, fine particulate matter, and related pollutants, as well as the loss of homes, churches, and schools, the loss of a once thriving community, living without power for an extended period of time, or having to evacuate your home, wondering if you could ever return. Others have been impacted by the indirect effects of the fire. Indirect exposure is knowing someone who was exposed. Relatedly, there are many people who have experienced a near miss, where your home or community was spared, despite being in close proximity to the fire. This can create feelings of survivor's guilt, where you're wondering why you were more fortunate to avoid the worst effects of the fire, while your friends and loved ones were so tragically impacted. And concurrently, millions more across the region and the nation were impacted by media-based exposure to the wildfires through television, online news, and various social media outlets. Decades of research has correlated these types of exposures with negative psychological outcomes, including post-traumatic stress disorder or PTSD, as well as depression, anxiety, increased substance use, and difficulty functioning in work, school, and social relationships. While the negative direct physical exposure impacts may seem clear, I also want to highlight the negative implications of high levels of media-based exposure to these types of events. So these are results from a large study of United States residents that was collected in the early weeks of the COVID-19 pandemic. Here, we see that increased daily hours of media exposure was associated with higher acute stress symptoms. And acute stress symptoms are essentially early symptoms of post-traumatic stress disorder. As the graph on the right shows, the content of this media exposure, as well as the amount, also matters for mental health. So the graph on the right shows that greater frequency of receiving conflicting information about the COVID-19 pandemic was further associated with reporting more acute stress symptoms. And I believe this is particularly relevant in light of the fires, where mis and disinformation was rampant on social media. I also want to highlight the impact that these types of exposures can have on the entire family. These are results from a seminal study conducted on children after the Oklahoma City bombing. And these results showed that direct exposure, indicated in green, indirect exposure, indicated in gray, as well as media-based exposure, indicated in orange, to the Oklahoma City bombing were all associated with increased post-traumatic stress in children from the community. And I want to highlight this because even if the children in your life were not directly or maybe even indirectly exposed to the fires, they may still be experiencing adverse psychological consequences from living in the community or being exposed to information about the fires through the news. Many individuals will experience psychological distress in the days and weeks following the fires, with symptoms that will dissipate over time. However, for a substantial percentage of the community, symptoms may persist or even worsen in the months and years that follow. To protect your mental health, it is important to reestablish routines with work, school, and recreation to the best of your ability, even if you or your family have been displaced. This is especially important for children who need to be provided structure as well as reassurances that they are safe and that you as the parent or guardian is there for them physically and emotionally. Relatedly, providing tangible support such as housing, clothes, and supplies, as well as emotional support to children, the rest of your family, your friends, and your extended community can be helpful to your loved ones as well as yourself. When providing emotional support, it can be helpful to say things like, "I'm here to talk if you want," without pressuring people to share their experiences, and then letting the other individual guide the conversation. Sometimes ruminating or thinking about a topic over and over again can reinforce symptoms, and spending time doing something fun or relaxing without discussing the tragedy can help reduce stress. Stay informed, but minimize repeated exposure to conflicting, graphic, or inflammatory news coverage. Avoid social media rabbit holes and repeated exposure to graphic images or conflicting and inflammatory coverage. With children, it can be beneficial to monitor content and watch news as a family so that you can answer questions and provide assurances of safety. Take action to protect yourself from future events, which Dr. Mahler will provide some examples of in the next section. This has the added benefit of helping you regain a sense of control and is associated with reduced psychological distress symptoms. Connect with friends and loved ones and make time for relaxation, play, spirituality, and recreation to reduce stress. This might look very different for those who are displaced or who have lost cherished places of worship or outdoor recreation areas. Explore new avenues to reduce stress if necessary, and realize it's okay to have variability in what helps. For some, it may be meditation, a walk, or other forms of exercise. For others, it could be watching a favorite television show, going to a movie, or finding spiritual solace in a worship service. Seek professional help if symptoms persist. Gently check in with your children and family about their well-being and monitor changes in mood or behavior, particularly in young children who may not have the words to communicate their distress symptoms. And finally, there's no one-size-fits-all approach to recovery, so it's important to be flexible with what you and others may need throughout the recovery process.
Thank you so much, Dana. Our next presenter, Dr. Miriam Mollier, is Assistant Professor in the Department of Environmental Health Sciences at the UCLA Fielding School of Public Health. Miriam is an expert in the role of climate change on wildfires. Thank you for joining us, Miriam.
Thank you, Ron, for the introduction and the opportunity to speak here today. I was asked to provide some context about the LA wildfires from a climate perspective. I'm going to start with talking about what we know so far about the contributing climate conditions. Then I'll share some initial data that shows the scale of devastation, and finally, a framework that addresses how we navigate public health and other concerns before, during, and after the fires. So some of our colleagues here at UCLA have put together preliminary analyses of the climate conditions leading up to the fires, focusing on three factors: abundant vegetation, an extremely hot and dry period, and then extraordinary Santa Ana winds. So first, the past 2 years were much wetter than normal in Southern California. And this allowed for a buildup of vegetation in the mountains and the hills around LA. And second, before the fires, we hadn't really had any significant rainfall since last spring. And at the same time, we had much warmer than average temperatures, which is what you see on the right-hand side. So this means that we had all this vegetation that grew and then dried out. And finally, the Santa Ana wind events dried out vegetation even more and allowed for rapid growth of the fires. So there were some gusts of wind that were close to 100 miles per hour in parts of the LA region. So how did this manifest on the ground? Over the course of this month, the Palisades, Eaton, and Hughes fires, as well as several smaller fires, burned around 50,000 acres. So this is a satellite image showing the footprint of the Palisades fire taken on January 6th, the day before the fire broke out, and then just over a week later on January 14th. So the brown areas are showing the area that burned in the mountains and hills, as well as the destruction in urban areas in the Pacific Palisades and Malibu communities. And you can see on the left-hand side, it's also annotated, that the burn scar reached to the Franklin fire footprint from last month. And at the same time, we had the Eaton fire in Altadena that was burning across town. Here's a closer look at the area that burned in the National Forest and into the neighborhoods of Altadena. And this is from an image collected on January 11th. So it shows a view of the scale of devastation in urban areas, and this has implications for the mix of emissions that will be coming from both natural vegetation as well as the developed areas. And now broadening out to the Los Angeles region with a series of satellite images that were taken over the course of the week while the fires were most active. The red areas are showing where satellites detected actively burning fires on each day. And you can also see the smoke getting pushed out from these areas across large areas in LA and out to the ocean and surrounding region. So I want to highlight that this was a really dynamic situation, both day to day and hour to hour, as the fire spread and the smoke moved across the region and potentially exposed residents who were located downwind. And finally, I want to share a framework for what is called fire-adapted communities. This incorporates several of the suggestions that my colleagues have already shared. And what we see here is that there are multiple dimensions to consider for protecting community health and safety from wildfires. And this includes what we can do before, during, and after. Some areas that are particularly relevant to public health are thinking during the fires about evacuation plans and routes and air quality monitoring. But then after, continuing to monitor ongoing changes in our environment, following guidance for how to clean up safely after the fires, preparing for flooding and erosion in the previously burned areas, as we saw with the rainstorm that came this past weekend. And as Dana was discussing, thinking about long-term mental health and trauma and how we can best support our Los Angeles community during the recovery process. So thank you, and I look forward to the question and answer.
Thank you so much, Miriam. Now we're going to begin the question and answer session. And just a reminder, you can pose questions by clicking the Q&A button down at the bottom of your screen. I'm going now to pass it over to my colleague, Dr. Rachael Jones, Professor and Chair of the Department of Environmental Health Sciences at the UCLA Fielding School of Public Health, who will share a few words and then moderate the Q&A session. Rachael, over to you.
Thank you, Ron. It's really my pleasure to be here today with my colleagues. I would just say there's a lot of information that's being gathered by our local and state public health and environmental agencies, as well as by researchers, that's intended to help us understand how people have been and are being exposed to hazards created by the fires and the potential health impacts of those exposures. And also to build upon what we've learned from previous fires so that we can be better prepared for subsequent events. We're going to address as many questions as possible today so that we can give you information to help make choices to support yourself and your families. Our panelists have joined us on camera, which I appreciate, and I want to remind the audience that you can submit questions via the Q&A function near the bottom of your screen. So Yifeng, I want to start this first question to you. And this has to do with the topic of the air quality index, which includes both a mass-based measurement of particulate matter and only a limited number of agents in the calculation. How can residents know whether the air in their immediate environment or in their local community contains other hazards that are present or might be present, like nanoparticles, asbestos, lead, or VOCs?
That's a wonderful question, and we receive a lot of concerns about what AQI really measures, what it doesn't really measure. As I mentioned, AQI that we're getting from EPA's air now, they're just really driven by PM 2.5. It's a mass concentration for those fine particles. There definitely are ultrafine particles like Mac alluded to, and other air toxins, including VOCs and other compounds. Lead, asbestos. So they're part of the PM. They're usually when they're airborne, they're part of the particles. So oftentimes when the particles and gas pollutants that coming from the smoke, if they get diluted in the same pattern by the wind is strong. So when the AQI is low, then the gas phase pollutants are often low as well. But as I mentioned, during the fires, because there's so much emission going on, and the gas molecules, they can actually diffuse against the wind trajectories to some extent and much faster than PM. This is oftentimes people can say, oh, I smell the smoke, but my AQI reported in my neighborhood looks fine. And that causes confusions. I want to clarify that. If you can smell the smoke, meaning that you are impacted. So AQI, in a nutshell, AQI doesn't measure everything. On typical days, AQI does give a real reasonable reflection about the general air quality going on. During fires, there's additional precautions that people need to take so that they understand AQI doesn't really have everything they measured, and there are things that are not reflected.
Mm-hmm. Mike, did you want to add something?
Yeah, I totally agree with everything Yifeng has said. But I'd also add that I think this revealed that we need to have a new monitoring network that's capable of characterizing the contaminants of health concern that are coming off of wildfires. And our monitoring network has evolved to deal with regulatory compliance, and it really doesn't have the capacity to deal with the metals, the VOCs, and some of those other health active components like the polycyclic aromatic hydrocarbons. So we need to think about establishing new networks that are going to be able to characterize these fire events, because they do have such a tremendous impact on so many people. And I think the other thing to realize is that from what Miriam showed, these are not just local smoke plume events, these are regional events. So there's a lot of additional information that's going on that is going to be more spatially dispersed from the fire that, again, our AQI may not be picking that up.
Yeah. Another point I think people alluded to, AQI, because it's based on mass measurements. And then we know there are evidence showing that per unit mass, the fire, especially with structured burning, the per unit mass toxicity of those particles could be higher than just our normal urban pollutants. So I think using AQI as a judgment, whether it's green or yellow, I think more precautions needs to be taken. Just because the toxicity of the particles are also very different. Even the AQI readings are the same. I think those are important factors that people need to keep in mind, especially for sensitive populations, individuals.
All right, thank you. So Mike, maybe I'll start this question back to you. And that is, it rained recently, which has impact on the air quality, and that it can remove a lot of contaminants from the air, while also then creating pools of water, which may contain some of the contaminants. And so two kind of parallel questions that you might respond related to this. One is, given the current situation, who, if anyone in Los Angeles, should be wearing a mask when they're out and about? And also, are you concerned at all with the rain potentially increasing or changing contamination on the ground, having removed materials from the air?
Yeah, so on the first question about masking, I think anybody that's going into one of the burn scar areas where there's going to be a lot of debris and a lot of ash on the ground should consider using a properly fitted N95 or KN95 mask. I think at this point, masking, unless we see extremely high levels of air pollution for people that are not going to the burn areas, probably isn't advisable. And people with existing chronic lung conditions like asthma have to be careful with masks, because sometimes they're not going to get enough oxygen through the mask, which will impede their breathing somewhat. On the multimedia transfer of contaminants from the atmosphere to the soil, a big concern now is that these ash particles could be re-entrained and brought back into people's houses. So simple preventive measures, making sure you take your shoes off at the door, cleaning up your property with soap and water. And that would be another instance where you might want a mask, is if you are cleaning up ash around your home, wear gloves and wear a mask. But so that is something we're actively working on. We're taking samples of the ash and trying to better understand what's in it. It's really unprecedented that we have such a large urban area that's been affected by this combination of structure fires, as well as a lot of chaparral brush.
All right, thank you, Mike. And let me turn here quickly to Miriam. Could you maybe talk a little bit about how the composition of the smoke differs between a wildfire event and when we get these wildfire urban interface types of fires?
Yeah,
What that means
absolutely.
for health.
So first, I want to build a little bit on what Mike was saying. I think there's both the concerns that we had with the rain and, thinking about debris flows. And this is going to be an ongoing concern for this event and others. We saw this in the Montecito fires, where there were devastating mudslides that happened in previously burned areas. So will be something that we need to be actively monitoring is thinking about potential sequencing in some of these events. As far as looking at the composition of emissions, part of what made this such a unique and devastating event is that we burned tens of thousands of acres in both wildland vegetation. And so that is going to emit a suite of gases and particulates that we have more information on because of large-scale field campaigns, laboratory experiments, satellite data. But then it also went into urban areas in the Pacific Palisades, Malibu, and Altadena. And so with that, where the concerns are, as Yifeng mentioned, is part of what is going to be in the emissions is everything that was in the homes and around them. So we would be expecting a higher concentration of toxic emissions versus if we're thinking just about the vegetation that is burning, trees, shrubs, grass, leaf litter, things like that. Although previous studies have found that wildfire smoke is potentially more toxic to the human body than what we see in the ambient urban particulate matter and other pollution mixture.
Thank you, Miriam. Now, I know, Yifeng, you have to leave shortly to go teach your class, but would you have any follow-up comments to this?
No, I think Mary did a really wonderful job. I think there's, questions if people are not quite sure. I think it's always helpful to be more on the precautious side, especially for sensitive individuals populations. Yes, I need to sign off and to teach PH 200.
Thank you for joining us today. David, let's shift gears a little bit. We had a question from the audience that noted that you mentioned in your introduction that there was you described a relatively disorganized emergency communication response. Do you have any ideas why and how might we be able to do better going forward?
I think there's a structural challenge in Los Angeles, which is that we have a county and then 88 cities, where Los Angeles is the top of the city heap, but it's one among many. And so we have this, disaggregated system. And so we also then have, as a result, fire departments at both the county and city level. And, we don't really have a mayor in the same way as other cities do, right? Because that has bred a kind of mayor relationship to the community that's not so much the executive leader in the same way, which is, I'm not going to comment on the politics of that, but what that matters in a disaster, what that means in a disaster is that we don't really have one person who emerges speaking for all. And, early on we heard comments like we need the kind of Andrew Cuomo or Rudy Giuliani that New York had during the pandemic or during 9/11. And the point is that, yes, we do need sort of centralized, organized person or office that brings all the information together and communicates it. And we don't need to change our political system necessarily, but we do need to change how we communicate to the communities in the disaster and after the disaster. right now, if you want to know what to do about going home or going into the water or anywhere else, you have to look for advice from Cali, PA, Los Angeles County Department of Public Health, South Coast AQMD, just to name the top three on the top of my head. And that takes a very sophisticated resident to figure that out. So it's just not a system that works for us in disasters.
Thank you, David. It sounds like we're going to have a long process to try to think about how to more efficiently communicate and organize all of these entities. So we get a lot of questions, I know, in a couple in this Q&A, but also to all of us in other contexts as well, about children playing outside and reopening of schools. And I want to ask about this from two perspectives. One, Dana, you had mentioned the importance of children getting back to their routines. So maybe you can comment on how parents might think about this challenge for themselves and their families, given this variability and the pollutant levels and uncertainty and changing over time. And then maybe after that, Miriam can comment on some of the practices of some of the other environmental aspects and physical health aspects of going back to schools.
Yeah, well, particularly for parents and kids, the research is pretty consistent. One of the best things you can do for kids is get them back in some kind of routine. And that doesn't necessarily mean the school that burned down, obviously. So if have relocated, finding ways to implement their former routine in a new environment can really help them feel more safe and secure and like things are going to be okay. Kids are naturally incredibly resilient, but they really thrive when they feel safe, secure, taken care of. So the more that those types of things can be reinforced and those structures can be set up, the better. Like it can be kind of easy in a disaster to just like fall apart, like you're falling apart. So, your kids, and it can be kind of easy to lean into that. But the more you can kind of really set up those structures for yourself and your loved ones, like even though it's difficult, like children respond really well to that. So.
Great, thanks. And Miriam, any comments on the playing outside?
Sure. I know this has been, we have many questions here in the Q&A, and then it's also been discussed a lot in the media and with individual schools. I'd like to, go back to what Yifeng was saying about taking extra precautions when there's actively burning fires in the area, and we have these concerns about how toxic the air pollution mixture was from the fires and the potential ash, and versus when we're thinking about our normal air pollution. But the basic sequence that she laid out is checking your air quality index, because that's going to be a really valuable source of information for how pollution is changing over time. A caveat to that is we have these different types of sensor networks. The government more gold standard networks that might be located quite far from where you are. So even though the low cost sensors aren't going to be capturing everything, as Yifeng mentioned, they can be really valuable in understanding more local changes. And if you look on those websites, you can change the averaging interval to 10 minutes or 1 hour. And so that's the first piece. Again, recognizing that this isn't capturing everything, using your sense of smell. So if you smell smoke, then heading back inside. And I think with that indoors, we're both going to have, that's already going to cut your air pollution exposure from being outside, and you can control the indoor environment more during smoky periods. You can run air purifiers, you can shut doors and windows, you can take off shoes. So as Mike mentioned, ash particles aren't getting tracked in. And so during these fire events, taking these extra precautions, but then as the pollution is getting cleared out and as we're getting more information from different government agencies as well as researchers, then making the decision about going back to normal activities.
Right. Thanks, Miriam. And I'll just add that in meetings that I've been in with government officials, it's my understanding that the schools have cleaning processes and protocols in place, and that they should at this point have been or are currently cleaning play areas and outdoor surfaces. So you should check that that has occurred in the play areas where you're considering having your children play. So one question about the water, and then we'll turn to some of the questions about returning to your homes in the burn areas. So David, can I ask you, when do you think it's going to be safe to go back to the beach and go swimming?
You know, Rachel, you asked that question because you know I'm a surfer. So this is really what matters. No, in all seriousness, it's an issue that we do need to alert the public about. There is concerns of fire debris runoff and pollutants in the water and on the sand that may contain toxic or carcinogenic chemicals. And as of today, the Los Angeles County Department of Public Health has issued an ocean water closure due to this fire debris runoff. You can check, one should check their website daily. Right now, it's from Las Flores State Beach down to Santa Monica State Beach. I myself am not surfing down in Venice here, so I'm a little careful about it. I'm going to wait a little bit longer. I don't have a good answer about when we'll be able to go back in, but I would recommend that we continue, all of us who love the ocean and beaches, check the Los Angeles County Department of Public Health ocean warnings on a daily basis.
Right, thank you. So Mike, let me turn a question to you, and if you could speak up a little bit because your audio was a bit quiet last time. There's a lot of concern about for people going back to the burned areas. What would you have as advice for people who lost their home and might want to go back and search through the rubble to look for safes and personal documents or family heirlooms?
Yeah, so if you are going back for that retrieval, make sure that you have personal protective equipment on. So N95 masks that are properly fitted. EPA has some good guidance, federal EPA, on how to fit the masks. Wear plastic gloves, wear plastic booties if you can get those so that you can dispose of them afterwards. And generally be very careful that you're going in there with first responders or someone else that's trained like an industrial hygienist to deal with those potentially hazardous situations, because floors can collapse unexpectedly. So you are going into what is still currently considered a hazardous waste zone. So you have to take proper precautions. And I think there's a whole other set of questions around, people that live in the burn areas and their houses survive. When can they go back? And we're out there actively testing both air pollution and ash, trying to give some guidance. But if you go in and you see evidence that there's been smoke penetration into your house, and it's usually in the interstitial areas, the windows. If you open the window and you see that brown or black line, or along the floorboards, or something that looks more like a spider web up in the corners, that's smoke impacted, you should have a registered industrial hygienist evaluate the property and test, and then recommend proper remediation actions. And much of this should be covered under your insurance. I know that there's been a lot of people jumping in to say they're experts in this, but I would really recommend that you go to a registered industrial hygienist.
Thanks, Mike. I just want to underscore a couple of points that Mike had mentioned there, and that is, returning to the sites, many of these areas are still being cleared by the hazardous materials team from the EPA, and there are real life safety hazards if the area has not been screened for hazardous materials. Lithium batteries from electric cars, for example, can start runaway fires. Damaged propane tanks from your barbecues could explode. So that's in addition to structural integrity issues. And it's critically important that you not bring your children to these areas because you don't want to put them at risk. But similarly, that when you enter those areas, the county Department of Public Health is providing kits with personal protective equipment. And part of the purpose of that is also so that you don't bring that contamination that's on your body back into your car and into your home. So when you're out in those areas and you're wearing your protective equipment, which would include, as Mike mentioned, gloves, a Tyvek bodysuit, booties, and a respirator, that you take that equipment off before you get back in your car so that you don't bring the contamination home. But turning back to David, what should people do if they have been concerned about their exposure to pollutants, to smoke and ash, such as in going back into their homes? What requires a doctor visit and what doesn't as a follow-up?
Certainly. Well, if you experienced smoke exposure and you experienced any respiratory symptoms as a result of it, whether it's upper respiratory just in the nose and sinuses, or in the bronchi, or further down, wheezing, chest pain, coughing, and this is continuing, or even if it is getting better, I think that's a reason to go see the doctor. If you are not sure and you've developed, I mean, all of us were exposed possibly to a fair amount of smoke and toxins for a couple days there, especially if we weren't wearing N95s, et cetera, in the beginning. If you develop upper respiratory or lower respiratory symptoms, so again, sore throat, wheezing, difficulty with breathing, coughing, chest pain, you might want to check with your doctor, especially if you have any pulmonary conditions or you're older or you're a child, but again, just developing those symptoms. I also want to talk about stress here. One can feel a lot of the mental stress in their body. For various biological reasons, that's where we feel it. And if you're starting to feel symptoms that you're not sure what they're from, you're having trouble sleeping, you're often anxious, you're getting heart racing and palpitations, or you're just feeling sad and depressed, and this is lasting more than another week or two, again, contact your primary care doctor and talk to them about this.
All right, thank you. We have a follow-up question, Mike, about returning to the sites. So if you're in an area where your house maybe is not severely smoke damaged and you need to, but there is some ash and debris on your property, potentially in portions of your house. Are there any guidelines or recommendations for cleaning things like walls and clothes, or should the attitude be, basically just to discard everything? And I know that this is a question that's somewhat difficult to answer because it depends on the severity of the damage to the home, but maybe you could give us some advice about how to think about this.
Yeah, I mean, there's a gradient here. So it goes from, extreme smoke damage of the kind where you're going to see those visible signs I mentioned, and you're going to smell the odor. In those cases, you probably are going to have to dispose of a lot of the furniture, the carpets. You may have to remove the drywall from the home, replace all of the insulation in the attic or any of the wall areas, because these are, particles that are microscopic, and they are also capable of off-gassing. So they will chemically transform over time so that the solid particles will begin to emit gaseous volatile organic compounds to areas where maybe they are much farther removed and they haven't had a lot of smoke. I'd still always recommend, if you have any suspicions, that you should talk to your insurance company if you have one, and try to get a registered industrial hygienist in there to do the assessment. But if you feel reasonably assured, then using wearing personal protective equipment of the kind we've talked about, and then using soap and water on visible surfaces and furniture is probably a reasonable approach.
Yeah, so as Mike was saying, you can clean a lot of the non-porous surfaces with soap and water. And then if you have carpets or upholstered furniture, you can use a steam cleaner. And generally the kind of ones that you might buy to clean up your house on a day-to-day basis, like around pets or something, those probably aren't sufficient. And so we would recommend that you go and rent one of the more industrial size steam cleaners, or you can hire a company to come in to clean that house to get the maximum impact on those upholstered items.
Yeah, and then if you are doing any vacuuming, to make sure that your vacuum is equipped with a HEPA filter so that you're not re-entraining and pushing out a lot of the particles that you're picking up into the vacuum.
Right. Right, because a lot of standard vacuum cleaners, they will reintroduce air into the room and with some dust. So you want to make sure that your vacuum cleaner has a HEPA or a high quality filter to protect that, prevent that. All right. Well, Mike, what is an industrial hygienist? You use that term. I self-identify as one, so maybe.
Yeah, well, you're probably better equipped to answer that question, but they are people that are trained in environmental measurement, so monitoring dust and other types of sampling, and then how to remediate properties. And they're often employed in industrial settings as well to try and keep workers safe. So I don't know if you want to add anything else as someone who is a registered industrial hygienist.
Yeah, so yeah, as Mike was saying, it's a specialty within the occupational health arena, but you may encounter industrial hygienists as part of a remediation company, or they might be recommended to you by the insurance company. So they specialize in taking measurements of airborne contaminants and sampling dusts. And so that may be a profession that you come across, and it does have a professional certification. So if you're looking at potential providers, you want to look for somebody who is a certified industrial hygienist or CIH. So let me go back to Miriam here. So as the cleanup continues and people start removing debris, or FEMA starts removing debris from sites, there's concerns that some of these toxic particulates might be reintroduced into the air. Do you think that that's something that people who are outside these burn zones should be concerned about, or do you think this is more of a local effect?
I'd love to have Mike weigh in after I answer, because I know that he's working with folks, and he himself are actively taking samples to try to address some of this. I know that's been something really challenging, is how to define what is burn adjacent. And if you remember back to those satellite images I was showing, the smoke plumes were highly dynamic. And so it's not going to be as easy as saying half a mile out, 2 miles out in concentric circles, because it depends both on where the emissions were and then how the wind was moving these pollutants through the atmosphere. So that's during the event itself. My understanding is that as we're going forward into the cleanup and rebuilding phase, that will be a more localized concern, is thinking about things like the ultrafine particulates and ash getting kicked up into the atmosphere, and other toxic pollutants. But that will be something, especially for workers and for homeowners who are going back into the burn scar area, that would be the level of highest concern. But many of us will remember back to as the fires were starting to get more contained, we did have another round of Santa Ana winds come in. And so there was an ash advisory alert given across most of the region. And that is because of the concerns that these ash particulates could get picked up, and then the high winds can move them from the burn scar areas. But I'd love to hear what Mike has to say about as we enter the next phase of the fire recovery.
Yeah, so I think that, one of the concerns that I've heard from residents, there are people that are going to be on truck routes. So right now, the EPA hazardous materials teams are going in and they're removing hazardous materials like lithium batteries that are obviously a major concern. After that, however, and depending on the soil sampling, FEMA will come in and basically remove the top 6 inches of topsoil. So there's going to be a lot of truck activity. And most of the trucks that are going to be transporting the waste are or the soil are going to be diesel powered. Diesel is a group 1 carcinogen rated by the International Agency for Research on Cancer. If you have an excess amount of truck traffic going by your house, that is a concern. And then it's also going to depend on how well the operators are controlled in terms of having their vehicles sprayed down as they leave the zone, having them have proper, they're sometimes called burrito wraps put around the soil waste. So that's going to be a critical component. And there will be some neighborhoods that are going to experience a lot more truck traffic than others, just because they're sort of on the natural route to get to the, many of the highways in Southern California.
Okay, great. And so as just kind of one, as we're approaching kind of near the end of our time, I just want to ask kind of one final question there before I turn a last question to Dana. So I think many people are wondering if their house is intact, but it's in this burn scar, if they get the remediation done, but there's still construction and debris removal going on adjacent to their homes potentially for 1 to 2 years, should they return to their homes, or what would you advise them to think about as they're making that decision? Mike, maybe you could start and we could ask David to follow up.
Yeah, I mean, I think that they're going to experience a lot more dust and noise and disruption than if they were, normally in the neighborhood. So they're going to have to be extra vigilant with running their HEPA filters, making sure they're not bringing their shoes indoors. Those types of things are going to be really important. I think everybody wants to go back to their homes, and that's completely understandable. We just want to make sure that those people that do choose to go back are doing so with the guidance of certified industrial hygienists or equivalently trained professionals, and that they are getting the right public health message about how to minimize their exposures. But I think many of us would have experienced our neighbors having a construction site for an extended period, and it's not going to be pleasant. So if you are somebody that's sensitive to dust or to noise, those are things to consider as you're going back into your homes.
David, do you have any suggestions for this situation?
Well, we will be at UCLA standing up a registry, a health registry, which members of the community can join. There'll be an opportunity for them to be assessed on a regular basis around their physical health and blood sampling, other sampling, so we can look at what kinds of toxins people have been exposed to and give them early notice about the results. So if community members are interested in that, they should get in touch with us at UCLA in the coming weeks.
Okay, great. And Dana, finally, are there any recommendations you would make about access to good quality mental health resources or informational materials?
I mean, there are a lot. I think one of the important things that I like to tell people in these situations is it's really variable, right? Like, so what works for one person is not going to work for somebody else. And to also, if you're experiencing distress in the immediate aftermath, like that's very common. I mean, you experienced a trauma or your friend or family member experienced a trauma. So it's not necessarily directly indicative of like a psychological disorder. However, as time goes on and you're still experiencing that distress or you're really impaired in the immediate aftermath, then that can be time to reach out. There's a lot, especially if you're, affiliated with UCLA. I mean, there's a lot of good help online these days, to even just something like betterhelp.com and something that you can do via telehealth. So, because especially if you've been directly impacted, your community may be in flux. And so I would suggest like some online telehealth resources in the immediate aftermath, reaching out to places like that can fit into your schedule and sometimes even be quite cost effective these days.
Mm-hmm. We had one final question that I'll take a quick effort at answering, and that's this question of why are we not recommending to wear an N95 if you're away from the burn zone at this point? Wouldn't just wearing a mask be better than wearing no mask? And I think the basis of the recommendation is that unless you are a person who's sensitive to respiratory effects, if you don't have an exposure, there's really not a value to you wearing a mask. So there's certainly no reason for you to you can choose to wear one, that's perfectly acceptable. But I think our point is that there really is not a health based recommendation to wear a respirator like an N95 while you're going about your daily life, unless you're sensitive to the air pollution exposures, or you are directly engaged in cleaning activities and debris. And we didn't really touch today on some of the recommendations for doing actual cleaning work and some of the information you might want to know about protecting if you have people working on your property, and some recommendations for protections during that cleaning process. And we're hosting another webinar on Thursday through the Southern California Education and Research Center that's focused specifically on that topic. And there are some important issues to understand related to having home domestic workers. So for example, if your family has a domestic worker who does housekeeping or childcare, that if you have them doing fire cleanup activities, that they are subject to OSHA regulations, that they're not subject to for their normal job functions, or if you're hiring laborers to come on your property and you want to understand what your responsibilities are towards their health and safety. So I encourage you to tune in for that. You know, we and our faculty are very committed to supporting our community through this recovery process. And based on our conversations, there's a lot of new information that's being gathered by our governmental organizations, as well as by researchers at UCLA and other institutions. And so I think in the coming months, we're going to have a lot of new information that will really help us to illuminate what we have experienced. So Ron, I want to thank all the panelists and turn back the session to you.
Great. Well, thank you so much to all of our experts for being with us today. A recording will be made available soon on our school's YouTube channel. And I'd like to thank all who attended today for joining us. Stay safe. Take good care, everyone. Have a wonderful rest of your day.